Welcome to InfoSource, a presentation of Berkshire Healthcare Systems, a not-for-profit system of post-acute healthcare services, including long-term care, short-term rehabilitation, independent living, assisted living, memory care programs, and hospice services available to our neighbors and families here in the Berkshires and beyond. Our topic today is hospice. November is National Hospice Month. And we've invited Pam and Brenda here to talk about hospice services and hospice care. Pam is a social worker, and Pam, you work in the patient and family support services, yeah. And Brenda is a registered nurse. And so, you know, I know that hospice can be a difficult topic for people, and I want to say from the beginning that meeting with you and meeting with some of your colleagues, it really takes special people to work in hospice services, and I have a lot of admiration, a lot of respect for you, and I want today's show to be hopeful, and that hope is what I get when I talk to you about what you do and the work that you do. And so what I wanted to do was kind of start the show on a note that I've heard you say, Pam, which is with hospice, we're helping families and patients have the best life, and their days may be shorter, but we hope that their days are better. So could you maybe introduce the show along those lines?
Sure. Well, when our patients come on to hospice, or when they first make a call to us, we know that they may have a life-limiting prognosis. So we know that time is limited. And we're here to help support them through this time. They get to be in charge, they get to make all the decisions, and we help have them have their best days. We'll try and manage symptoms, provide support in all areas, physical support, psychosocial, spiritual, whatever anybody needs in order to have the best days that they can with the time they have left.
That's great. So November, which is National Hospice Month, what is the history of hospice? How did it get started?
Well, it's really interesting. It started in England, and Dame Cicely Saunders, after World War II, she was a nurse, and she saw that people were really in pain, physically in pain, emotionally, spiritually in pain, and she decided to start a philosophy of care in England, and what she did is she started St. Christopher's Hospice. So how did it get to the United States is kind of the important part. So she came to speak at Yale New Haven's School of Nursing. And there was a woman there, Florence Wall, and she actually spoke here in Pittsfield for one of our big meetings a while ago before she passed in her 90s. And she started the hospice here in the United States. And then over 30 years ago, Hospice Care in the Berkshires started.
So let's talk about how Hospice Care in the Berkshires got from New Haven up to Pittsfield.
Good. Well, there were. It was originally here a volunteer organization, and then in 1982, Congress passed the Hospice Act, which expanded access to hospice services and allowed physicians and other caregivers to be paid through Medicare and private insurances. So it really was just an expanded access, and that's how hospice started. And then, of course, it's grown into over more than 30 years, you know, what we see today with really expanded access to the community from what we had in the beginning when it was a voluntary organization.
So along the lines of getting from all volunteers to how many people do you have working for you now?
Well, we have over 100 volunteers.
Wow.
So then our nurses, social workers, home health aides, and chaplains. So we have, and our office staff, huge office staff too.
So how has hospice changed and evolved over the years? I know you both have different perspectives from a nursing or a social worker perspective, but how has it changed since it started?
Well, I think, you know, Brenda and I were talking before that in the beginning, when we even first came here, there wasn't a lot of alternative therapies, even supportive therapies like physical therapy, occupational therapy. Treatments were kind of suspended. Now, if things are for comfort, for palliation, then what they're doing is they're allowing a lot more access to other services. Plus, we have things like art therapy, we have massage therapy, which really can help people. So even non-medication interventions that certainly improve people's quality of life.
Do you have an example of maybe a patient that you've helped through that art therapy to?
I do. We recently had a patient who, just a phenomenal artist, so detailed, beautiful work. And he was, knowing his time was limited, and he ended up working with our art therapist. She took pictures of all his works, and he actually wrote about how the subject matter came up, what materials he used, what his train of thought was during that time, which was an incredible thing to be able to leave for his family and his grandchildren.
Yeah.
So beautiful, beautiful catalog that she did, and everybody was really pleased to be able to see that completed work.
And I bet that has therapeutic benefits for the patient and for the family too.
Right, right, exactly. He was thrilled to be able to have his work cataloged. It kind of gained, stature with everybody, and then also just his family was thrilled to be able to have this catalog of all his paintings.
And his legacy was carried on through all this beautiful artwork that previously had been around, but not in one area where everybody could view it and think about them, the happy memories.
So Brenda, in terms of nursing, how have you seen nursing change for hospice over the years?
There's more choice around where patients want to live. We visit in all different areas, the assisted living, nursing home, their own home. We have a team approach where the case manager is in constant connection with our social workers, our chaplains, our hospice aides, and our volunteers, so that we can be sure to uphold that plan of care.
Right, exactly. What Brenda's saying is really important. What we do at hospice is we try and cover all aspects of our patients, the physical care, the psychosocial issues, any spiritual concerns, and I don't mean religion. That's part of it, but it may not be for everyone. But just any spiritual concerns, and then also just everybody needs to be able to get out. If you're a caregiver, you need to be able to go grocery shopping or to an appointment or to a movie, and we have staff that can support you in those things, so you can also have a life while you're caregiving.
So it sounds like, I know I've heard you both talk about holistic treatment and not just treating the physical aspect of the disease process. And it sounds like it's very well rounded in terms of what Hospice Care in the Berkshires provides.
Yeah, we recently got a thank you card from a family member, and she said, she mentioned, that hospice were like angels, and she said that we were like geese angels, all flying in formation, kind of knowing what each other does. But she said it was really helpful that we're very well coordinated. We speak to each other multiple times a day. I know we're on the phone with Brenda at the office and everyone else during the day, and I think the quality of care just is really improved by that level of communication.
So the team approach that you use, can you explain that more? Maybe who's on the team? And I know there's a lot of communication, but it sounds like they work together in a lot of different ways too.
Well, we have interdisciplinary team meetings twice a week, and we have our social workers, our chaplains, registered nurses, and hospice aides and volunteers. We all support each other and talk about the cases that we have weekly, and we all learn from each other, learn different aspects that one could find during a visit with our patients and families, and we also have our medical director who's present at every team meeting, so we can review more intense symptom management with her, and then just move into all the psychosocial and spiritual and physical needs of the clients.
And we also have a pharmacist who's at this group meeting. So what we're trying to do is make sure that all the patient's goals and express wishes are followed. We do not require that our patients be at home. So we will try, if somebody needs to attend their grandson's wedding, or needs to go on a trip or to an anniversary surprise party out of state or something, we will contract with another hospice in the area so that whatever our patient needs at any given time, we can address. So it's really important.
Do you have a story of someone taking a trip like that?
I actually do. We have a couple couple people that come to mind, but we had a gentleman who loved to gamble. He just really loved the casinos, and once or twice a month he would say to us, I just really want to get down to the casino, and he had a family member who could take him, and we would contract with another hospice in the area so that he could go to the casino. And recently we had a husband and wife who had a 65th wedding anniversary, and their 3 children who were out of state wanted to have this surprise party. So they had wanted to get to this person's house, this daughter's house anyway, and they ended up having this huge surprise party for their 65th anniversary with people that they had actually known in their childhood.
Oh, wow.
Who were present. And when they got there was this big tent, and the daughter explained to them that the tent was there because the neighbor was trying to put up this tent to see if it really worked. So they and we were coordinating with the children in the other state just to try and make sure they got this surprise party. And we had they made a beautiful photo album that we got to see on this wonderful surprise. So
that's great. So on that note, what I'd like to do is show a video about hospice care in the Berkshires, and then we'll be back. Thank you.
Nestled in the center of the picturesque Berkshires of western Massachusetts, Hospice Care in the Berkshires has served the county for more than 30 years. Hospice Care in the Berkshires is a proud affiliate of Berkshire Healthcare, the state's largest nonprofit provider of nursing, rehabilitation, and senior housing in Massachusetts. Berkshire Healthcare is committed to fulfilling the health and residential needs of the people in the communities we serve. Hospice Care in the Berkshires offers comfort, compassion, and the emotional and spiritual support families and patients value when faced with life-limiting illness.
When my mother-in-law was diagnosed with terminal cancer, we had hospice come directly to our home. It's where she resided and wanted to have her care done. It was a tough time for the family because it was a shock to find out the limited amount of time that she had. But when we started working with hospice, they came in and worked with us wonderfully. They helped us navigate through all the administrative tasks. They told us about all the services that were available to both the patient and the family, the social workers, the home aides, the nurses, and really helped us get through this tough time.
Our caring, dedicated, and experienced team of professionals supports patients and families where they live, whether it's at home, a nursing home, or assisted and independent living facilities. This team includes hospice-trained physicians, hospice nurses, family counselors, spiritual counselors, and hospice aides.
Oftentimes people ask us, why do you work for hospice? Why would you do this? Why do you work with dying patients? And I think most of the people on our team would say that it's an honor to work with people at end of life. It's an honor to try to support families and patients through end of life, to make sure that they are cared for with dignity, that they die peacefully, that their families are supported through that process. It's our goal to make it even a little bit better if we can. We can't change the outcome, but to be there and to support families through the process and patients through the process in every aspect is really important.
And we do try to support both the physician and the patient and family at this time in their lives in whatever location that patient and family want to be.
And I just knew that when I retired, I wanted to be part of helping people that were dying and didn't have someone to be there to support them. I knew that that's something I wanted to do.
Our incredible team of hospice-trained volunteers are instrumental to the support we offer families. Our team of over 100 volunteers helps with transportation to appointments, running errands, and respite for the caregivers.
When you know that you can make a difference and that person is secure and feels not as scared because they have someone to sit there to hold their hand, I just can't tell you, you just feel like you're floating on a cloud when you leave. And to be there when they actually die and to know that you've made it easier for them, you just can't explain that.
Hospice Care in the Berkshires is grateful to the many people who make donations. All the funds raised support the agency's community programs and services, an integral part of how we serve Berkshire County.
Bereavement services at Hospice Care in the Berkshires are funded through philanthropic dollars from the community, and that would include donations, memorial donations, and also community events that we have, such as our gala, our remembrance walk that we have every September, and that allows us to provide bereavement services to all members of the community, not just folks who were hospice patients' families.
I would definitely recommend Hospice Care in the Berkshires to other families. Again, the range of services was wonderful. In fact, I love the organization so much that I now volunteer and help other families who are going through it.
Choosing hospice isn't about giving up on life. It's about choosing the support needed in order to live a full life right now. For more information about how Hospice Care in the Berkshires can help, call us at 413-443-2994.
Welcome back. And I am here with Brenda Manning and Pam Macy Williamson from Hospice Care in the Berkshires. And we are talking about hospice. And I wanted to, I'm sure that calling hospice is it's a very important decision. When is the best time to call?
Well, I think when somebody has been diagnosed with a life-limiting illness, that would be a good time to call. We have patients who have received treatment, and either the treatment has maybe not gone particularly well, or they've become very ill and decided to discontinue treatment. That's a really good time to call. Anyone can call at any time. You can refer yourself. Anyone can have an informational. So if you even had a family member or a friend in another state and you just wanted to know about services, to have the conversation, anyone can call hospice and receive information.
And it sounds like the earlier somebody calls, the better, because then you would be able to get to know them and know what their wishes are.
Mm-hmm. Taking advantage of the full range of services is really key to being sure to having your goals upheld. So we do emphasize that.
Yeah, we'd like to get to know you sooner rather than later. The longer our patients are on, the more benefit they have told us that they feel. And we have a family survey that we send out after our patients pass, and the biggest comment has been, we wish we had called you sooner. Mm-hmm. So we really encourage people to call us. We really can provide healthcare advocacy too. So even if you are not going to come on right away, if it's maybe down the road even, just having somebody to be able to talk it through with is really important, and we have the staff that can do that. Just like you would, if you had a foot problem, you go to a podiatrist, or a car problem, you go to an auto mechanic. Well, hospice really, we're really the experts in end-of-life care and concerns, and we'd love to be able to talk to anyone that has a concern or questions.
Great. What does patient and family-centered mean?
Well, patient family-centered, what that means to us as an agency is that we enhance what is in place for the patient and family. There are a range of goals that a lot of our patient and families have, and we build a care plan to uphold those goals. And we are visiting daily, or depending on the needs, and learning to adjust to that with different interventions and changing the care plan as needed.
Right, and we will, you get to be the person in charge. You get to be, the coach, and we're going to be the ones out there in the field helping meet your goals. So at any time, you can call our office. We're a 24-hour a day, 7-day a week. There's no holidays or evenings. We're not available. So I think that's a really helpful thing for families to know, is that if it's 2 o'clock on a Saturday evening and somebody's having shortness of breath or pain, or maybe just an emotional, difficult time, we will answer the phone, and we will visit if you need a visit. So I think there's a real peace of mind in knowing that we're not going to take a holiday or vacation off. We're there all the time.
And that's certainly patient-centered and family-centered.
Yes, yes. We will follow whatever, we will listen to what you have to say, and as Brenda said, we will build the plan of care around your goals and your wishes and your family's wishes. And sometimes people come on to hospice, maybe they really aren't ready for services emotionally, spiritually, but their family or their spouse really needs the support. We have had husbands and wives come on so that their family would be supported, and then they find out that really how much hospice services have improved their quality of life. So sometimes it might not be that the patient is totally 100% on board, but the family is requiring really from caregiving and just somebody to be able to answer the questions.
Yeah. So how else do you care for the family as well as for the patient?
Well, we have spiritual counselors. We have, as I think we talked about in the very beginning, we have volunteers. So if we had a husband who every Wednesday he was with a walking group, and his wife was our patient, and we provided a volunteer on those Wednesday mornings so he could get out with his friends, have a cup of coffee, and then go take a walk, which, as you can imagine, that just really improved his quality of life. He had given it up for a couple of months as his wife declined medically, and really felt he couldn't get out. And we were there to tell him that yes, we could support that, and we encouraged it. Our nurses, our case managers, they provide an awful lot of information about things that, including myself, although I'm a medical social worker, I'm not a nurse. So they provide answers to questions. They contact the physician. So I think theirs is a critical role. Our chaplains provide incredible support for wherever the patient's at. Our patient and family support are providing answers to pretty much the non-medical questions that the nurses don't answer, or maybe the financial piece. Our aides are providing hands-on physical care so that you can keep your role as a family member and they can provide some of the care for our patients. And then again, our volunteers, they may be reading the paper for somebody, they may play music, they may discuss sports, they may discuss current politics, now that it's election day. So wherever the patient's at that day, that's what we'll always try and provide support around what anybody needs on any given time.
And I've heard you both say that there's a freedom to hospice and a freedom to the services that you provide. Can you tell me a little bit more about that?
There is a freedom as our patients decline in their disease process. A lot of the times adaptive equipment will be needed to continue on and be independent. So we all as a team recognize those needs and address them, whether it be something as simple as a walker to something extensive as a recliner chair. We'll be right there and be able to facilitate that easily. And a lot of times making those phone calls that the family members have been burdened with for so long, to the pharmacies, to the medical equipment. So we take over that, and in collaboration with our team.
Right, and also you do not have to be housebound. I know with some agencies, they require, in order to have services at home, that you be at home. We do not require that at all. In fact, we encourage people to continue to spend time with their families, go wherever they need to go, and really do whatever it is they would normally do before we even showed up at the door.
The freedom.
Right.
Right. How do you ensure that Hospice Care in the Berkshires is a high-quality organization?
Well, we have great communication amongst our team members, and because of that, the needs of the patients are known very fast. We have a very fast response time to any changes that a patient or family member have. We also have electronic documentation, so we can pull up any information, the latest information on each patient, and address the needs immediately.
Right, and all our staff, our nurses, we have RN case managers. We do have LPNs that follow the plan of care for our patients. Our family support people. We have ongoing education that occurs for all our staff, actually. Chaplains, we're encouraged, Berkshire Health Systems encourages ongoing education for every affiliate and every person involved. And so there's ongoing training and support for our volunteers, our home health aides, every person in the administrative staff, ongoing support and education for all our staff.
Great. That's great. Well, thank you both very much for being here today.
Thank you.
And this has been InfoSource, a presentation of Berkshire Healthcare Systems.